Hi, I'm Rachel Mech, attorney with Offit Kurman, and I'm here with Dr. David Fajgenbaum, physician scientist at the University of Pennsylvania and national best-selling author of Chasing My Cure, which comes out in paperback on January 26th. Hi, David.
Hey, Rachel. Thanks so much for having me today.
Thanks for being here. Can you tell us a little bit about your story?
Sure. So, in Chasing My Cure, I shared my story going from being a healthy third-year medical student to having my last rites read to me back in November of 2010, and eventually being diagnosed with this really terrifying illness called Castleman disease before fighting back and trying to search for a treatment that could cure my disease. And I'm here today because I found a treatment that saved my life, and now we're applying these principles to many other diseases.
Saved your life and the life of many, David. Correct?
That's right. Thankfully, you're right. My book's called Chasing My Cure, but we probably should have called it Chasing Our Cures because, as you know, this has been, a lot bigger than just me. And it's not just about finding a drug that's helped me. It's thankfully helping other patients. And more recently, we've been thinking about how can the principles and some of the tools that helped us to figure out a drug for me, how can they be applied to other conditions like COVID?
Yes, can you please tell us more about that? I saw that you're also now heading up a COVID initiative and the research and data behind, is it the cytoic storm that you encountered with Chase by Cure?
That's right. Yeah. So in Castleman disease, you know a bit about Castleman disease because, of course, we've been friends for years. But Castleman's involves the immune system getting totally out of control and attacking your body and actually literally, destroying your organs, and you need chemotherapy to stop it. Unfortunately, in COVID, a similar sort of immune hyperactivation happens. And as you said, it's called a cytokine storm. And so what we've learned from Castleman disease and some of the treatments that we've advanced for Castleman's actually are really at the top of the list for most promising and even most effective drugs for COVID-19. So back in March of this last year, you probably remember Friday the 13th of March was the day that the US really shut down because COVID was sweeping across the country. And on that Friday, the 13th, I had a conversation with my team where we realized that there was so much of what we learned for Castleman's could be applied to COVID, and so many drugs that are effective for Castleman's may work for COVID, that we decided to redirect a large portion of our team towards searching for the cure and for treatment for COVID. And so we started a project called the Corona Project, where we've collected data on over 300,000 COVID patients. Over 300 different treatments have been tried. And thankfully, some of those have been really promising, and others we're working with the FDA to push forward.
That's amazing. And David, just to put it in perspective for the audience here, I'm going to show them a couple pictures from your book so they can really, I think they really put into perspective the illness that you were suffering, how it relates to COVID. So for the audience, this is the Dave that I knew well in his college football finest. David and I are both very proud Georgetown Hoyas and alumni, and David was the healthiest one around. I mean, how much could you bench?
It's like 75 pounds, but who's keeping track? Something like that.
So, and Dave, so to go from that to when Dave was really, really sick, these are a couple pictures, and I don't know if the light is doing it justice, but this is Dave and in the hospital. Dave with your dad, who's also a physician.
That's right.
But when Dave was really sick, he was confused for his dad's pregnant wife.
That's right. Yeah, that picture there was taken just a couple of weeks after New Year's Eve of 2010, and it was so this gentleman who confused me. He was drinking on New Year's, and my dad and I were walking around the floor at this hospital, trying to get try to get a little exercise on New Year's Eve, and this guy saw me, and I had this huge belly because my liver and my kidneys weren't working, and so it had this giant belly, and my head was bald from chemo. And as we passed this gentleman, he fell onto the ground, and he fell out of his chair because he was just so drunk. And my dad helped him into his chair, and he looked at my dad and I. He said, "Thanks so much. Good luck to you and your wife." And we're like, "Wife? What is he talking about?" Then I looked at my boy and I realized that he thought that I was my dad's pregnant wife, and that was a low point emotionally for both of us. But I turned to my dad and said, "Man, Dad, you got an ugly wife," and we laughed really hard. And I think that one of the main reasons why I wrote Chasing My Cure is because I learned so many lessons about life, lessons that have just fundamentally changed who I am. That I felt like if I'm going to go through what I went through, I'm going to learn these things. I need to share them with the world. And I have a terrible disease. I'm doing really well with it right now, but I wanted to share those messages while I'm here and while I can share them. And one of those messages is that in the midst of really tough times, humor can be really powerful. I mean, there were times in the ICU where like you think the last thing that my family or I would do is laugh, but actually laughing with the people you love really helps you get through some really tough times. And so I think that concept of laughing with the people you love is something that resonates now during COVID. I mean, we can't physically be with a lot of the people that we love, but we can, through Teams and Zoom and this sort of stuff, we can try to laugh through the tough times.
Well said, Dave. I mean, you look great now, and so you're obviously doing wonderfully. And um, tell the audience really about what was going on with you, and take us back to then. You were a med student and then a business school student. This is no slouch, people. He has all of the degrees, but when you actually started feeling sick, you were seeing the best doctors in the world, the best that was known out there about Castleman's disease. But with your background, you took into your own hands your medical fate. And I think that's important for, people to understand. I mean, obviously now we know what COVID is, and we're on our way to a cure there, thanks in part to your research and data. But really take people to that moment and tell them what you did to take this into your own hands, and without spoiling the book, and really what led to the cure that you found for Castleman's disease. Tell us about that.
Sure. So so critically back in August of 2010, and I spent almost 6 months hospitalized up until February of 2011 in critical condition. Liver, kidneys, bone marrow, heart, lungs, all of the vital organs that you need were completely shutting down. I mentioned I had my last rites read to me in November of 2010 when the doctors just knew that I wasn't going to survive. I was out of options. But thankfully, I got the diagnosis, idiopathic multicentric Castleman disease, this really rare and deadly immune system disorder. And so they started me on chemotherapy, and the chemo saved my life. But unfortunately, I relapsed just a few weeks later, and I was back in the hospital. Again, this time I was hospitalized for 7 weeks. Chemotherapy again saved my life. And I was actually able to get out of the hospital and was really hopeful that maybe I could go back to medical school. And my plans, as you know, I lost my mom to cancer when I was in college, and I was training with the hope of maybe one day being an oncologist to treat cancer patients in her memory. And so I was like, yes, I'm back on track. We've got Castleman's under control. I can go back to what I was, trying to do. And then about a year later, I relapsed again. And as you know from the book, that was just a major turning point for me. I went from being I think I describe myself as like an optimistic, hopeful person that like, what, if I just, see the right doctors, they're going to find the right solutions for me, to really realizing that if I was going to hope for a treatment for me, I couldn't just hope. I couldn't just be hopeful. I needed to hope and act. I needed to turn my hope into action. And so when I relapsed on that drug that we had hoped would work for me, and I was out of options, that's when I decided I would dedicate my life to trying to find something. And again, I think this is just such a critical lesson for my journey. It's important that we hope, and it's important that many of us pray, but we can't stop at hoping and praying. It's got to be, okay, what am I hoping for? What am I praying for? What can I do about it today, tomorrow, and the next day? And what can I keep doing about it? That really, I believe, gets us closer to that which we're hoping for is action. And so I started a foundation called the Castleman Disease Collaborative Network, and I started conducting laboratory research at Penn, and eventually found a drug that's been around for 30 years that no one had ever thought to try. And based on what I'd done in the lab, I thought that it could work for me, and took just kind of I guess a major bet, or just a major chance. I didn't have any other options. Caitlin, who which is my fiance at the time, wife now, we were engaged, and I just wanted to make it to May 24th, 2014. I had, a date in front of me that I wanted to make it to. Yes, that's Caitlin and I. That's actually at our engagement party, that picture in the bottom right. And just wanted to make it to that date so badly, and knew that I wouldn't if I didn't try something. And here we are 7 years later, and I'm doing really well.
Incredible. And Dave, this doesn't spoil the book. It doesn't, but you ended up being your own best doctor. You saved your own life because you noticed a symptom that doctors and medical textbooks and test results were basically telling you to ignore. Isn't that
Exactly.
right?
There were a number of aspects of my early presentation and symptoms early on that no one really was paying attention to. And even I wasn't totally paying attention to them. I didn't know what they meant, but it turned out that some of those early signs would come in to be really, really important as we were trying to piece this thing together. And I talked about how the title of the book, I feel like, could have been changed in a number of ways. One part, it shouldn't be chasing my cure, it should be chasing our cures, because it's a lot bigger than me. But another part is the term cure. And I think that, all of us search for cures for diseases. I mean, that's what you want. You want something where it's never coming back. And so a lot of times when people will read Chasing My Cure and hear my story, it's kind of like, this is great, you cured your disease, what are you working on next? And then the reality is that I'm doing really, really well. It's now been 7 years. But for most diseases, you don't know what tomorrow is gonna hold. And so I actually don't like to use the word cure myself, even though it's in the title of my book. But I'm so hopeful and I'm so thankful for the 7 years that I've had. And I feel this real obligation to the universe, to the world, but to something, to try to basically copy, recapitulate what we've done in my case for other diseases. The idea that this drug that I'm on was sitting at my neighborhood pharmacy for years while I was in and out of the ICU and no one ever thought to try it makes me think, how many other drugs are also just sitting at a neighborhood pharmacy while someone's struggling with their own condition? And so this concept of drug repurposing, it's a really simple concept, and that's that drugs developed for one thing might also be able to be repurposed for something else. Maybe just no one's done it yet. And so that's something that we've become, really, really committed to, and actually working with folks from the FDA to try to make this a reality.
And Dave, isn't it true that Facebook, the Zuckerberg project and TAM project, has funded your research? Because I believe they called your data the best that they had ever seen in terms of organized and real-time really test results. Isn't that true?
Yeah, that's right. We've been forced to partner with the Chan Zuckerberg Initiative for about a little bit over 2 years now. For folks that aren't too familiar with CZI, this is Mark Zuckerberg and Priscilla Chan's enterprise that they set up to try to do good in the world. And they've invested a tremendous amount of money into a number of initiatives. And early on, they decided that rare disease was going to be one of the areas that they wanted to go into, because unfortunately, even though each rare disease is rare, when you combine them all together, collectively, rare diseases are very common. So about 1 in 10 Americans has one of the 7,000 rare diseases. And so it's together as a group, it's a very common group of diseases. And so they felt they could make a real difference in rare disease. And we were really thrilled that after spending quite a bit of time getting a sense for how other rare disease groups were making progress and the approaches they were taking, that they picked our effort, the Castleman Disease Collaborative Network, and said, we want to basically copy what you're doing and share these tools with all other rare disease groups. And it was just, such an honor to think that the work that we're doing could be spread, and it's been awesome to work with them. They have an effort now called the Rare as One Initiative, and it's been really great to work with them. It takes partnerships. I mean, you know this, and your clients who are watching know this so well. None of us can do this alone. That's why it's not chasing my cure. It's chasing our cures, because we have to work together. But with partners like CZI and FDA, friends like you, we can do this sort of stuff.
Well, Dave, while you might be critical of the title, it is a national bestseller that, again, for the audience, comes out in paperback on Tuesday, January 26th. So I think you picked the right title here. It has been a cure for you and a cure for so many. I remember reading about a young girl, I think she was 5, and same drugstore drug that you found to cure you has been working for her, and is now healthy. How old is she today?
So she's 9. She was the second patient to get it. I mean, you think about, and we were chatting about this before we started recording. It's kind of like, you can make decisions for yourself, but for your kids, it just gets a lot more complicated. And you think about, this is a drug that I decided to start taking. I hoped it would save my life. And thankfully it has, but the decision that this young girl, Katie, that her mother and her father made, do we put our daughter, who isn't seeming to benefit from anything else, on this drug as the second patient ever with this disease, is another just sort of, hard to imagine moment for that family, but they made this decision. She went on, and she's gone on to do really, really well. Her mom's actually a really big part of the Castleman Disease Collaborative Network. She's really helps to support patients and loved ones. And so it's a real community and a real family. And Katie's doing really well.
Oh, well, Dave, that's great. I mean, saving lives, found a cure for Castleman's. I'm sure with your research network, you are going to honor your mom, and cancer's right around the corner. If I bet on anyone, Dave, I bet on you. And I know that your research has been pivotal in COVID. So in another segment, we'll talk a little bit more about that. But thank you again. Thank you for being with us today. Again, Dr. David Fajgenbaum, physician scientist at the University of Pennsylvania and national best-selling author of Chasing My Cure. This is the hope that everybody needs to read in 2021. So I'm telling you, go out and get your copy. Again, it comes out in paperback on January 26th. Thanks. Thank you, David.
Thanks so much, Rachel.